As a survivor, it is not only my privilege, but it is my duty to speak out on behalf of the people of West Africa who continue to face unspeakable devastation because of this horrific disease.
The Indiana doctor who survived the Ebola virus met with members of Congress and President Obama. Dr. Kent Brantley says Americans need to do more to help people in Africa before the disease spreads across the Atlantic.
NBC's Erica Edwards says the U.S. is increasing its response to the Ebola outbreak, an epidemic that some medical experts say is unparalleled in modern times.
The U.S. military will join the fight against the worst Ebola virus outbreak in history.
Ebola is treatable.
Operation United Assistance will expand the U.S. response in Africa. President Obama outlined details of the plan after a briefing at the Centers for Disease Control.
We're going to create an air bridge to get health workers and medical supplies into West Africa faster.
3,000 members of the military will deploy, but will not have direct contact with Ebola victims. Their goals will be to build 17 Ebola treatment centers with 100 hospital beds each, set up mobile labs for faster diagnosis, and train up to 500 healthcare workers each week. Before traveling to the CDC, the president met with medical missionary Dr. Kent Brantley, who became infected with Ebola while serving in Africa and survived.
To control this outbreak and save the lives of thousands of West Africans and possibly many Americans, we need the promised Ebola treatment units, the surge in healthcare workers, the U.S. Military Regional Command and Control Center, and we need it immediately.
The U.S. plan will provide more than 10,000 sets of personal protective equipment and send 400,000 kits to homes in Liberia with gloves, sanitizer, and fever-reducing drugs. About 5,000 people have been infected. Half of those cases occurred within the past month.
The numbers can be kept in the tens of thousands, but that is going to require a much faster escalation of the response.
Nearly 2,500 people have died, likely a vast underestimate. The U.S. plans to send 5,000 more body bags, a grim prediction that the number of the dead will grow. Erica Edwards, NBC News.
Indianapolis first responders are getting help to deal with work-related stress and emotional issues. A new initiative, an anonymous helpline, will be up and running next month. That means firefighters and police officers will be able to seek help without supervisors or their peers knowing. Officer Phil Smiley says after years of seeing horrific crime scenes and medical emergencies, he realized he had PTSD, or post-traumatic stress disorder.
Doing CPR on an infant, nobody can prepare you for that. Nobody can prepare you to see the things that police officers see every day that humans aren't supposed to see.
Officer Smiley said he got help by talking with a therapist. It's the kind of help the city wants other police officers, firefighters, and medics to seek out.